Yeah, I'll go ahead and start with some introductions as we get the updated slides up.
Good.
Can you all see the slides?
Perfect.
Okay.
Lacey, I can see the slides, but I thought that the ones that I sent had the Latin 19 logo. Does this have the copy of the resource guide at the end?
Yes, it should.
All right. Just wanted to make sure.
Let me just, now, how do I get out of screen presentation?
We are seeing your screen presentation. I'm not sure.
So where would it be, Lindsay? Just make
Well, it
sure.
looks like it's got the right stuff at the end, so we'll ignore that.
Okay, great.
The right
Yeah,
logos at
this
the
is
front.
what you sent to Angie. So,
something didn't
all
happen
right.
correctly with the saving at the beginning, but it's no big deal. Hello. My name is Lindsey Bickers Bock, and for many of you who are regular attendees, it's good to be able to come and talk with you about more than just the work that we've been doing around COVID. So my role is to serve as the Division of Health Education Director, and I've done a great amount of work with the Latin 19 crew around COVID, around health literacy, around vaccines, but we actually do quite a bit more over in the health education division. And so today we're excited to share a little bit about the work that we're doing around overdose prevention and substance use disorder, and in particular talking with you about a resource guide that we have available in both English and Spanish, and thinking about ways we might better maximize the use of that resource guide in the community. So I'm going to kick us off by introducing colleagues of mine who are doing a lot of this work, and then I'll come around at the end and have some facilitation of conversation about the guide itself. But first, I will hand it over to Lacey Schofield to say a little bit about her role.
Hi, everyone. I'm Lacey Schofield, and I'm the Overdose Prevention and Response Projects Manager at the Durham County Department of Public Health. Thank you so much for inviting us to speak today. So all over the country, we are experiencing an epidemic of overdose. In 2022, more than 100,000 people died of an overdose in the United States. Nearly 1 in 10 adults in the U.S. has lost a family member to drug overdose. The map in this slide is data from 2021. States with the darker blue color had a higher rate of overdose that year. That really dark blue state on the right side is West Virginia. It is clearly the darkest blue, which means it had the highest overdose rate. And it's actually been that way for a number of years. North Carolina is not as dark, but it is one of the darker blue states, which means that we have a higher rate of overdose than many other states in the country. Overdose rates have been rising over the past couple decades, and this is mostly due to opioid drugs. Opioids include prescription pain medications, heroin, and fentanyl. Currently, more than 75% of drug overdose deaths involve an opioid, and there are now over 1.6 million people in the U.S. diagnosed with opioid use disorder. This graph is a graph of overdose deaths from the year 2000 through 2022. The blue line is North Carolina as a whole, and the orange line is just Durham County. So there are two interesting things, I think, about this graph. First, you can see that the rate of overdose in Durham has consistently been lower than the rate in North Carolina as a whole. But for the first time in 2022, the rate of overdose in Durham was higher than the rate in North Carolina, and unfortunately, it seems to be going up. Another thing that stands out on the graph is this really large jump from 2019 to 2020. Well, what happened in 2020? That was the start of the COVID pandemic. During the COVID pandemic, many people were isolated and they experienced a great deal of stress. Drug use and overdose increase when people are very stressed and isolated. I also want to point out that the number of deaths in Durham in 2022 was 124, as you can see up here at the top of the slide. But that's just the number of overdose deaths. The number of overdose reported by Durham EMS was 829. So a lot of people who overdosed did not die, thankfully. But that is a lot of overdoses to have in 1 year, and the number is going up. EMS has reported that there were 100 overdoses in July alone this year. So this graph shows the drugs that contributed to overdose deaths in Durham. About half of all overdose deaths involve multiple drugs. So there are deaths on this graph that are counted more than once. Here at the beginning in 2012, cocaine and opioids were about equally responsible for opioid deaths. In addition, at that time, the opioid deaths were mostly due to heroin. Over time, opioid overdose deaths have been rising drastically, and that is mostly due to fentanyl. By 2021, fentanyl was involved in the large majority of overdose deaths. So what is fentanyl? Fentanyl is a synthetic opioid 50 times more potent than heroin and 100 times more potent than morphine. There are two types of fentanyl: pharmaceutical fentanyl and illegally made fentanyl. Both are considered synthetic opioids. Pharmaceutical fentanyl is prescribed by doctors to treat severe pain, especially after surgery or for advanced stage cancer. Most recent cases of fentanyl-related overdose are linked to illegally made fentanyl, which is distributed through illegal drug markets. It's often added to other drugs because of its extreme potency, which makes the drugs cheaper, more powerful, more addictive, and more dangerous. Only 2 milligrams of fentanyl is considered a potentially lethal dose. It comes in a variety of colors, shapes, and forms, including both pills and powder form. You cannot smell it or taste it. And it also has many street names. This slide lists just some of those names. Okay, so now I am going to put up 3 statements. And after each one, I would like you all to type in the chat whether you think it's true or false. So the first, simply inhaling or touching fentanyl can make you high or overdose. Do you guys think that's true or false? So I see like a bit of both, true, false, about 50-50. Yeah. Okay, well, I'm going to answer. It is actually false. It's a myth. Unfortunately, it's a myth that many people believe, including many police officers. A few years ago, there were reports of police officers that died because they touched a bit of fentanyl while they were investigating or arresting someone. It turns out that these stories were completely false. They were never corroborated or proven. Fentanyl does not easily go through the skin. You actually have to ingest it to get high or overdose. You have to swallow it. Next statement. Okay, many victims of fentanyl poisoning were unaware that they ingested fentanyl. So go ahead, put it in the chat. Yeah. So you all got that one. This one is true. And it's unfortunately true. There have been several recent news stories of teenagers who overdosed and died because they bought pills over social media. For example, Snapchat in one case. These kids thought they were buying a drug like oxycodone or Percocet or even Xanax in one instance, but the pills actually contained a lethal dose of fentanyl. And the stories are true. All right, last one. Drug traffickers mix fentanyl with other illicit drugs to drive addiction and create repeat business. Yeah, it's true. Yeah, but it is just one of the reasons. So true with a caveat. I mean, it's also because it's cheaper. They do put fentanyl and other drugs to hook the client, who then becomes addicted and now needs to buy more fentanyl. Also, sometimes there are cases where there's just accidental contamination. White powders from different drugs often look the same, and sometimes they accidentally get switched in the process of making drugs. And of course, nobody is overseeing the places where the drugs are made, so that can happen. Okay. So what are the signs that someone has overdosed? It's very important, so I'm just going to read them out. They are unresponsive or unconscious. Their breathing is slow or shallow, or they have stopped breathing. You hear them gasping for breath or gurgling. You check their pulse, and their heartbeat is slow or it's stopped. Their skin is pale, cold, or clammy. They have blue lips, skin, fingernails, or toenails. Their pupils are small. And vomiting can also be a sign of overdose. If someone has these symptoms, you need to act fast or they could die. What to do when someone overdoses? So the first thing you want to do is call 911 right away. Some people are afraid to call 911 because they worry that they may get in trouble with the law for taking drugs or just being present when someone has overdosed. However, there's a law called the Good Samaritan Law. It protects people in this scenario. In general, you cannot be prosecuted if you call 911 to help someone who has overdosed. After calling 911, administer naloxone if you have it. There are two types of naloxone, one that you inject into the person's thigh, and there's also a nasal spray called Narcan that you spray up the person's nose. Naloxone is a medication that counteracts the effects of opioids. It revives the person who overdosed and starts them breathing again. Naloxone is not harmful, so it is safe to give to a person even if you're not sure that they have overdosed from opioids. I encourage everyone to have access to naloxone. You can get a free Narcan kit at the pharmacy in the Durham County Public Health Building downtown. After naloxone, or if you don't have naloxone, perform CPR if you are trained. The important thing is to get the person breathing again and to start circulation if the heart has stopped. If the person does not start breathing on their own after about 2 to 3 minutes, give naloxone again. So that would be another injection or another squirt up the nose. And finally, stay with them until help arrives. Sorry, I think, right. I skipped over the recovery position. You want to place them in the recovery position after performing CPR. You can see the position pictured here, a hand under their head and a knee bent so it stops the person from rolling onto their stomach. Now I'm going to turn it over to Donna, who's going to discuss substance use disorder.
Okay, thank you, Lacey. Can you hear me?
Yes.
Okay, great. I'm Donna Rosser, and I'm an injury prevention health educator with the Durham County Department of Public Health. I have a few different roles in injury prevention. I work with suicide prevention, domestic violence prevention. Also, I coordinate the Durham County Firearm Injury Prevention Partnership. And I also work with Lacey in opioids and substance use disorder treatment and prevention. So I'm going to cover some information, give you some background information on substance use disorders. So I would dare say that most of us know someone who has a substance use disorder or SUD of some kind. And have you ever wondered how it happens? Many people don't understand why or how other people develop a substance use disorder. They may think that people who use drugs lack moral principles or lack moral principles or willpower, and that they could stop their drug use simply by choice. These beliefs are driven by stigma, which is a set of negative beliefs that a group or society holds about a topic or group of people. Stigma affects all of us, and nearly everyone has felt stigmatized or has stigmatized others at some point in our lives. Stigma is rarely based on facts, but rarely on assumptions, preconceptions, and generalizations. Therefore, its negative impact can be prevented or lessened through education. So let's get down to it. In reality, a substance use disorder is a complex disease of the brain rather than a moral failing, and quitting usually takes more than good intentions or strong will. Drugs change the brain in ways that make quitting hard, even for those who want to. Fortunately, researchers know more than ever about how drugs affect the brain and have found treatments that can help people recover from substance use disorders and lead productive lives. A substance use disorder is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control despite harmful consequences. The initial decision to take drugs is voluntary for most people, but repeated drug use can lead to brain changes that challenge an individual's self-control and blocks their ability to resist strong urges to take drugs. These brain changes can last a long time, which is why substance use disorder, or SUD, is considered a relapsing disease. In other words, people in recovery from substance use disorders are at increased risk for returning to drug use, even after years of not taking the drug. It's common for a person to return to drug use, but returning to drug use doesn't mean that treatment doesn't work. As with other chronic health conditions, treatment should be ongoing and should be adjusted based on how an individual responds. Treatment plans need to be reviewed often and modified to fit the individual's changing needs. Substance use disorders mostly involve substances that affect the brain's reward circuit, causing euphoria, as well as flooding it with the chemical messenger dopamine. A properly functioning reward system motivates a person to repeat behaviors needed to thrive, such as eating and spending time with loved ones. Surges of dopamine in the reward circuit cause the reinforcement of pleasurable but unhealthy behaviors, like taking drugs, leading people to repeat the behavior again and again. As a person continues to use drugs, the brain adapts by reducing the ability of cells in the reward circuit to respond. This reduces the high that the person feels compared to the high they felt when first taking the drug, an effect known as tolerance. They might take more of the drug to try to achieve the same high. These brain adaptations often lead to the person becoming less and less able to gain pleasure from other things they once enjoyed, like food, sex, or social activities. Long-term use also causes changes in other brain chemical systems and circuits as well, affecting functions that include learning or the ability to discover new information, judgment or the ability to come to sensible conclusions, decision making or to determine which choice is best, stress, to recognize it or to react to it, memory or to recall what you know or have learned, and behavior or what actions to take. Despite knowing the harmful outcomes, many people who use drugs continue to take them, which is the nature of a substance use disorder. Now, what if the drug is a medication, a prescription opioid? Opioids have been used for hundreds of years to treat pain, cough, and even diarrhea. How do they work? Your brain is full of molecules called receptors that receive signals from other parts of the body. Opioids attach to receptors on nerve cells in the brain, spinal cord, the intestines, and other organs. This allows them to block pain messages sent from the body to the brain, which is why they're prescribed following surgery and for serious injuries or illnesses like cancer. When the opioids attach to the receptors, they slow your breathing and generally make you feel calm. They also cause a large amount of dopamine to be released in the pleasure centers of the brain. Now, are they addictive? Yes. Over time, opioid use can change the brain, leading to opioid use disorder. Many people develop opioid use disorder, leading to deadly overdoses. However, many people who take prescription opioids for pain become dependent. Dependence means your body has gotten used to the drug and it'll hurt or feel uncomfortable if you suddenly stop taking it. A person can be dependent on a drug without developing a substance use disorder. But sometimes dependence can lead to a substance use disorder if you don't make an effort to stop taking the drug. Okay, can a substance use disorder be cured? This is a big question. As with most other chronic diseases, such as diabetes, asthma, or heart disease, treatment for substance use disorder generally isn't a cure. However, substance use disorder is treatable and can be successfully managed. People who are recovering from a substance use disorder will be at risk for returning to drug use for years and possibly for their whole lives. Research shows that combining medications to treat substance use disorders with behavioral therapy ensures the best chance of success for most individuals. So now we're going to go back to stigma a little bit. And stigma about people with substance use disorder might include unfounded or inaccurate thoughts, like they're dangerous or incapable of managing treatment or at fault for their condition. And how does it affect people with substance use disorder? Feeling stigmatized can make people with substance use disorder less likely to seek treatment. Feeling stigmatized can make a person with substance use disorder less likely to seek connection and cause others to avoid connection with people with substance use disorders. And as Lacey mentioned previously, that isolation is thought to be responsible for people, the increased numbers of overdoses during COVID. So I just wanted to say a little bit about person first language, and then we're going to actually watch a brief video about it. So person first language maintains the integrity of individuals as whole human beings by removing language that equates people to their condition, in language that equates people to their condition or has negative connotations. And for example, my colleague Donna is blind, and that would not be using person first language. But using person first language, with an example of that would be my colleague Donna has a visual impairment. So the change shows that Donna has the disability rather than is the disability. So I wanted to have you all watch a brief video about person first language and why it is important to consider when it comes to persons who use substances or in recovery for substance use.
My name is Gord Garner. I'm here living in Ottawa, and I'm living in recovery from substance use disorder. I'm the chair of Recovery Day Ottawa, and I'm a certified addictions counselor.
I'm Chelsea June. I'm part of the musical duo Twin Flames. I live here in Ottawa, and I've been in recovery for 12 years.
Hi, my name is Yai. I'm from Twin Flames. We're a music group from Ottawa, and I've been in recovery for about 3 years now.
Words matter because we begin to describe ourselves, and people describe us by our behaviors, which are a result of our condition, aren't reflective of who we are. We're actually the people who don't approve of our own behaviors. But when we get merged in our behaviors, there's no way out. If that is what I am, then that is what I am. So where's the exit then? If I'm a person who's suffering from these behaviors, then I remain a person and I have an exit into that person. So I think it's critical that we change language.
So when I first started talking about my recovery and felt comfortable enough to open up about it, I used to say that, you know, I've been clean for however amount of years it had been at the time. But when I met Gord, he used the term recovery, and I never once heard him use the term clean. And when I described myself that way, he kind of spoke a little bit about the word recovery and how much more of a gentle approach that is. Because saying that you're clean, it's almost like saying that you were dirty at one point or you were doing something wrong. And I think a part of recovery and a part of accepting those choices that we've made in the past are being able to make peace with it and then be proud of who we are today in this moment.
Well, I think that when you're hearing the terms like abuse and you know, being clean and using those common terms that are being used today, it just kind of takes away from the actual problem.
Everybody has this language and they want to get their own experience, and I try to be very respectful for how people describe their experience, but at the same time I want to recognize that the research shows that changing the language will change the outcomes for people. So we don't want to stigmatize people in recovery because of the words they're using for their experience, but we want to look at those words and see if they're still being effective. And both Chelsea and Yowie obviously they're singer-songwriters. They believe in words, and so with different words, different outcomes, different meanings. So I think it's a beautiful thing. And I saw one of their performances for children last week at the NAC, and the kids were in love with them, and I had to be careful not to push them aside so I could go dancing. And having that opportunity and seeing the work they're doing in the communities that they're doing it in, with voices and language that I don't have, and imagery that I don't have, and skills that I don't have, really gives me great hope for the future. And to know that I'm a small part of that is a joy. I used to darken doorways. That was my experience for many years. And so not to darken doorways, but to bring light to places. It's a beautiful life. And I think the key I want to say is the language I used on myself to describe my behaviors as if they were me didn't allow me to have the life I have today. And until I could imagine being something other than my behaviors, I couldn't be. And so I think imagination is critical. And these folks are working full time on raising the imagination of children to be together and to be joyful and to have good lives. It's beautiful.
Okay, thanks. So we'll turn it back over to Lindsey.
Actually, I'm gonna do a couple slides and then we'll go to Lindsey.
Okay, sorry.
That's okay. So, what can we do as a community to address the overdose epidemic and the epidemic of substance use disorder? First, we need to educate people and get the word out about the problem. We need to talk to people about the dangers of fentanyl in particular and what to do when someone overdoses. Donna, Lindsey, and I work for the Durham County Department of Public Health, and this presentation is just a part of the county's strategy to educate the community. We've also created a resource guide that Lindsey will talk about a little later. The second thing we can do is encourage people with opioid use disorder or other substance use disorder to seek help. There are many places in Durham that offer effective treatment for this disease, treatment that includes counseling and medications. Some places even provide treatment for free if you are uninsured. If you or a loved one are struggling with substance use, I encourage you to seek treatment. And at the end of this webinar, we'll talk about some of the places that you can go. Finally, there's harm reduction. We have to recognize that there are people in our community using drugs, and many of them are just not ready to seek help yet. Harm reduction is the act of keeping them as safe and healthy as possible until they're ready to seek help. And we need to make sure that they stay alive long enough to do that. Harm reduction includes ensuring people have access to naloxone. I mentioned earlier that you can get free Narcan kits at the Department of Public Health. We also give out free fentanyl testing strips and sterile syringes. For people who inject drugs, using new sterile syringes instead of sharing used syringes greatly reduces the risk of getting sexually transmitted infections. On this slide, you can see a picture of 2 fentanyl testing strips. For people who are using drugs, no matter what drug they use, we encourage them to test a small sample of their stash to see if it is contaminated with fentanyl. If it does contain fentanyl, the person would then know not to take the drug, or at least to take a much smaller amount. Also, they may think twice about buying drugs from the same dealer again. I just wanted to talk a little bit more about treatment for opioid use disorder. Medication-assisted treatment, or MAT, is now considered the gold standard for treating people with this disease. MAT includes medications such as methadone, which has been around for a long time and most people have heard of it. But there are also newer medications such as buprenorphine and Suboxone. Suboxone is buprenorphine combined with naloxone. These medications relieve the withdrawal symptoms and the cravings for opioid drugs. In combination with counseling and behavioral therapies, they are very effective at treating opioid use disorder, and they're much more effective than counseling or therapy or 12-step programs alone. Unfortunately, there's a lot of stigma surrounding MAT. Some people believe that people are just trading one addiction for another when they take medication like methadone. But that is simply not true. MAT has been proven to reduce criminal activity, overdose, and death. MAT allows people to live a more stable and productive life, and they can stay on it long-term if needed. Opioid use disorder is a disease, and taking medication for it is no different than taking a life-saving medication for any other type of disease, like taking insulin for diabetes, for example. So right now, I'm going to navigate away from the slides, and I'm going to put 2 links in the chat. That is not the link I wanted. Give me 1 second. The first is the link to the video. Bear with me. Copy that. Okay. Putting it in the chat. That way, if you wanted to view the video again, you can just click on this link and it'll take you to the YouTube. And the next link, I'm going.
Lindsay, I don't think you sent it yet. Or did you send it yet?
Is it in the chat? I put it in the chat. Oh,
Was,
looks like I
you must
accidentally
send.
direct messaged it. Okay, let me try that again. I need to, I don't know, put it to everyone. Okay, let me try that one more time. Can you all
Alright.
see that now?
We will
Okay,
got it
great.
now.
So that's the link to the video. So the next link is the link to how to get to our substance use resource guides. That's really long. That's actually, yeah, okay, that's it. So it's somewhat long. And that link will take you to this page. Can you all see the website? Okay. This is the Department of Public Health's website, and we have a page for substance use disorder resources. This link takes you to the English version of the guide, and this link takes you to the Spanish version of the guide. And it looks like this. We also have hard copies. Lindsay's going to talk a bit about them. They include lists and contact information for treatment providers, harm reduction services, recovery and support groups, housing options, and more. When we created the Spanish version, we did not just translate the English version word for word. We included some additional resources that are specifically relevant for Spanish-speaking and Hispanic individuals. Now I'll turn it over to Lindsay. She'll talk about more about the guides and what's in them. Got to pull up the PowerPoint and let me just get it in show mode. Oh, well, that's
As Lacey gets it to the slide, I want to thank both her and Donna for sharing some contextual information about common myths and resources and person first language. We hope that has been a helpful framework for having the rest of the conversation today. Our goal for the rest of the time today is to share a little bit about this resource guide, let you know what's in it, which I'm going to page through kind of virtually, and then also have you all think with us about places that we need to distribute this guide. So as Lacey mentioned, this is it's a booklet. It's 14 to 16 page booklet. And it has a lot of information, everything from crisis information to treatment providers, harm reduction services, and then more of the support services that go around things like housing and food assistance and other resources that individuals responding to substance use disorder might want. We currently have printed 5,500 copies of the guide, and like you've heard, they're available in both English and Spanish, even though they're not exactly the same. And we've been working to distribute these across Durham. So they're in emergency rooms, at the hospital, different behavioral health facilities. We have a really strong partnership with EMS, community paramedics. So they are distributing them generally, but especially when they go out after overdoses, when people might be especially prone to receiving treatment or resources. We work with the detention center here in Durham. We've done outreach to faith communities and worked with a number of community-based organizations. That being said, what we have found is that there's a lot of organizations that we work with that requests something like 50 copies of the English guide and 10 copies of the Spanish guide. And we know that when they go to different outreach events, most of what they do is provide English guides. And as we've monitored the use, they sometimes are not able to distribute the Spanish guides as often. So one of the things we wanted to think with you about, and we'll share a little bit more about what the inside of the guide looks like first, but we'd love to think about where are places that are serving people in Spanish that we should make sure to get Spanish guides to, because we hope that this resource guide is helpful for individuals who are using drugs, but also people who are family members, who are friends, who might be in a situation where they're experiencing somebody else overdosing, and having this be a resource that makes them more comfortable. So keep that in mind as we kind of flip through it, and then we'll, before the hour ends, open up for a little conversation. So Lacey, if you want to flip on to the next slide. What I did is I tried to show both the English and the Spanish together, and I know they're generally much too small, but I wanted to emphasize what Lacey already said, which is that the Spanish guide is not just a direct translation of the English guide, that we've really tried to think about what information is culturally relevant, what resources are especially able to support individuals who are Spanish speakers or who are part of the Latinx community, and provide specific information about that in the guide itself. So this is the overall table of contents for both the English and Spanish guide. And so just wanted to highlight that they're similar, but they're different. And so it includes information about educational information. What is substance use? How is it treated? Some of the information that's educational includes the Good Samaritan law that I know someone was asking about in the chat. We've also provided information about overdose prevention and recognizing an overdose, which you already just heard in this presentation. So there's pieces of education that are in the guide, and then also resources. So these are the table of contents for the English and Spanish guide. And then if you go to the next slide, Lacey. This is an example of how we've organized similar information, but differently across. So we've tried to start at the beginning of the guide with information that people might need in a crisis situation, acknowledging that peer support specialists help people develop a network of support, and also a plan for recovery when people are interested in accessing treatment, but acknowledging that things like a 24-hour access line might be really important when somebody needs to know the next step. Thinking about how people can go to an observation unit if somebody is in a detox situation, but then also always pairing it with some of that educational information. So that's at the beginning of the guide, and you can flip forward. We've also been really clear about providing information about which organizations offer medication-assisted treatment, which you heard a little bit about, and we've actually provided in the description information about payment options, and also which places provide counseling in Spanish. So you can see we have the medication-assisted treatment, and then also other therapy and counseling providers. And so if we flip one more page forward in the slides, we've highlighted this is a place where we've especially adapted and provided different information in the Spanish guide than the English guide. So for you all who are regular attendees, you know that El Futuro is doing this work. We've identified places that are serving the broad Durham County population, like the LGBTQ Center, but what sort of resources they have for Spanish speakers. So we've tried to really pull out and customize the guide in ways that are specifically helpful. We've also added, you can see on the upper right, some specific websites that are designed to help people connect with healthcare providers, mental health care providers who might be a good fit for them. So those are some of the examples of the ways that we've tailored this specific guide. Go ahead and flip forward, Lacey. And then just highlighting again that we make sure that we provide that overdose prevention and survival information in both guides. And I think we can flip forward once more and then open up for some conversation before we, totally run out of time, but highlighting some of that harm reduction information is the last thing that I wanted to share that's in here, including not just the education, which you see on the left in English, but on the right, the information that's available about safer syringe distribution and information for testing for sexually transmitted infections and other resources that help people get the care that they need regardless of where they are in their drug use. So before we wrap up today, I do want to make sure that we have an opportunity for people to share any thoughts they have about ways that we might improve the guide. We have updated this 2 or 3 times since we first created it. We've also worked with different partners to distribute it. And I would just love to give a few moments for some conversation to hear any questions that people have, or places that you feel like we might do some additional education or outreach as we go.